Talofa, my name is Suzanne Utai. I am a mental health practitioner and counsellor with over 25 years experience. I run a private practice. I work in the emergency department of mental health in the hospitals, and I serve with the Royal Flying Doctors, providing fly in, fly out care. I was born in New Zealand to an Australian mum and a Samoan dad, and I'm a proud mum of a blended family of 8 children. My passion is helping people navigate life's challenges and finding hope in the... Okay. So over here, and I think it's over there as well, it's been Suicide Prevention Month for September, and in October it's Mental Health Month. On the 10th of October it's Mental Health Day. And so as a clinician and working with people with mental health issues, I just wanted to talk more, especially with our Polynesian community, because it's been a really tough time for our Polynesians to talk about mental health. So I wanted to ask you a few questions. First being, I want you to introduce yourself and tell us who you are.
No problem. Thank you for the opportunity, first of all. I think this is a very valuable service to the community, and I hope whatever insights you receive from our conversation will help someone who's listening. For the audience, I'm Seti Matua. Born and raised here in the United States, I did spend about 7 years of my life in Samoa, mostly my formative years, but I've been here in the state of Utah for most of my life, and married now, well, I guess a long nows ago, with 5 sons, and 3 of them are married, so we now have 5 granddaughters. But as far as profession is concerned, I've worked in mental health as kind of a support to other people. I've also helped other people out through the Church of Jesus Christ of Latter-day Saints as a bishop. So in a young single adult ward, which is age groups from 18 to 30.
Awesome.
And I think that's it.
Okay. Yeah. Awesome. Thank you. All right. So what does mental health mean to you personally?
To me personally, I guess I should preface my statement by saying that for many years, I think there was this generational thing we grew up with as Pacific Islanders, Polynesians, thinking that, and I don't think this is any different from most people who are raised in our households, that when someone says something that seems a bit off or does something that seems a bit off, they just chalk it up to, oh, he's just being crazy. And then they just dust it off and move on. And for most of my life, I felt that way until I became more and more aware of some of the things, maybe social cues that I was missing as well. So when I think of mental health, I think of both the psychological and emotional well-being of a person, which some of the factors that might add to it are what your social circles are and how you behave in those social circles. I think that's how I've often looked at it.
Yeah, that's so true. I think I was brought up, thinking that mental health is you're a really crazy person, and it's been a really negative stigma. Anxiety is mental health, and everyone gets anxiety at times, and so it's been a real change in how we understand mental health.
Yes.
That stigma has still stuck a lot, and so as soon as I say mental health, they mean crazy, but mental is just the mind, and so we've got to rework sometimes to say we're not saying you're crazy, we're just saying we have struggles, because everyone does. Yeah.
Right. I absolutely believe that, because growing up, you hear, and you're, I'm not a mental health professional, you are, Suzanne, but I just remember when someone, so say for example, there was a loss in the family or a loss of a relationship, and you're feeling sad, which is what everybody feels. You're given a kind of social window to say, okay, your sadness should be over by now. It's time to move on. But it's not always the case with many people. It's like, I remember when my mother passed away, I was sad for a very long time, and realized that I needed someone with professional credentials to actually walk me through some of the sadness, some of the anger even that I was experiencing. And it was after that, of course, a lot of praying and speaking to ecclesiastical leaders as well, that I finally was able to deal with the feelings and emotions that I was going through.
Yeah. And we're so fortunate. You're a church member. I am too. We're so fortunate that we have our spiritual side, and I talk a lot of, I work with a lot of church members, and I talk about our spiritual side as a help. But, sometimes we say we break our leg, we can ask for a blessing and we ask for help, and my mum knows what to do. She gives me some medication, helps me to feel comfortable, but I still have to go to a doctor and be able to fix physically. And it's the same thing, with our mental health. We go to our ecclesiastical leaders, they can give us a blessing and they can help us, but we still do everything we can, and Heavenly Father will take care of the rest. Yeah.
That's right.
Yeah. Okay. What about, have you seen mental health impact people's lives in your work or in your daily living? How have you seen that?
I have. And it's, growing up in our generation and generations past, as a man, we are terrible at maintaining our mental health, because we just feel there's something about us that says we are the breadwinners. We need to take care of our people, so we can't show any weakness in moments when we are feeling weak. But those are perhaps the moments when we need others most. Is where we can say to a trusted person, say, "Hey, I'm feeling this way. I'm sorry I reacted in that way, but I'm just going through some things." In the past, I know that my father, myself, my brothers, everyone, anytime they were approached about, "Man, you seem a little bit off. You're a little too angry," in a very simple situation, like, well, and we would just say, "I'm just okay. I'm okay. I'll deal with it." But those are the situations when you really need someone most.
Yeah, it's so.
I've seen it in the workplace. I've seen it in. I've seen it with my family members, and it can definitely affect the way that we relate to people.
Yeah, and you're right when you talk about, especially men, they're the breadwinners. They're supposed to be tough, get over it, just do your job, and I guess over the last 10 years things have changed. I see more men in my therapy sessions, Pacific Island men, and the first thing they come in and say, "I'm not crazy," or they tell me that my sister told me I have to come, or my mum told me I have to come. So I feel really uncomfortable, and they tell me they feel very uncomfortable. And they're right. And I go, I agree with you. This is a really uncomfortable thing. We're not used to it. We're not used to talking about our emotions and feelings. And so it's slowly changing over the years that we can go, seeking help is actually healthy. It's taking care of ourselves.
And I actually believe that you can be a stronger person if you understand what it is that's affecting you mentally, so that you can be stronger for other people. So I remember with a family member in particular who was just going through some really difficult times, and he turned to alcohol and substance abuse as a way for him to get away from all of his problems, and it didn't end well. So I think if you have the strength to say, "I need help," that's a good start. And then it's nice to have someone else say, "You're not crazy. You just need you need some tools to figure out what it is that's happening in your mind."
Yeah, and so true.
And it's more than your mind, isn't it, Suzanne? It's when you talk about emotionally, it's from your heart as well. And we're just as Pacific Islanders, we're driven by heart.
Yeah. And that's what I say to people, when we're hurting in here or we're hurting in here, it's the same. We get the help we need. And you're right, when we talk about, a lot of people turn to drugs or alcohol or doing crazy things that are not their norm. They're coping mechanisms. Drinking is a coping mechanism for a lot of people. It's not a good coping mechanism, but it's a coping mechanism. And so it's looking for better coping mechanisms. Yeah.
Yes.
Okay. What do you think are the challenges then? Why do people not speak up when they're struggling with issues? What is the biggest barrier, do you think?
For me personally, I just look at the social situation that I'm in, and also things that we've just, whether it's a Pacific Island cultural thing or culture in general, wherever we live. I'm not sure how it is in Australia, but sometimes there's things here in the United States where it becomes socially acceptable to do something, like denying that, or having this thought that there's nothing wrong with you, when it's obvious that there's something that has changed in you, especially if there is an emotional event that has taken place, that is even a job loss. I remember getting laid off from a job and thinking, how am I going to move forward from this? And the longer it took to find a job, the harder it became for me to overcome the hurdle of mental health. So I think it has a lot to do with social things as well as cultural things.
Yeah, so true. What about, so we've got over here, and I'm sure it's over there, it's Suicide Prevention Month in September, and then October it's Mental Health Week. We have a Mental Health Week and a Mental Health Day. Why do you think those kinds of things are important in our community?
I think they're very important because it allows mental health professionals like yourself to be advocates for getting the mental health tools that you've mentioned, those coping mechanisms, good, healthy ones. And sometimes if we just hear a catchphrase here and there, maybe it sparks some interest in some people. But if there is a month dedicated to suicide prevention or mental health, there's you can actually ramp up campaigns that lead to those things to help people understand that these are the resources that are available to them. And I don't know, when I was growing up, there were never those types of resources available to us. And if there were, you had limited access, or you just weren't aware of them. Yeah. So I think having a month or two where you can actually talk about some of these things may trigger a response in someone who doesn't really know that these things are available to them.
So true. And even I work in the field and I work in it every day. But when it comes to Suicide Prevention Month or Mental Health Month, I go, what more can I do? What is something different I can do? And that's why I reached out to you and have reached out to a few people to go, what else can we do? What's something different than the norm that I do every day? Yeah. So I think
it's very important. I think the other reason why it's important to have suicide prevention and mental health months is because the common person, the lay person, doesn't understand what the warning signs are for someone who is going through some type of mental health trauma. So it's nice to be reminded during those months that, hey, if you see someone who is has distanced themselves from you, or is not having the same conversations, doesn't seem upbeat. Many of us have had those situations or an experience where you're like, I wish I had known that sooner. Mm-hmm. So having these months allows us, the layperson, to know, hey, these are the resources we can pass on to someone or to ourselves to help someone out.
Yeah. And I think it's so important. Recently, there's been a couple of suicides, completed suicides, so they passed in here, of Polynesian men who no one knew what was going on. And that's the hard thing. We keep everything in, and we feel like people feel suicidal because they feel stuck. There is no way out. There's no place. And so being able to reach those people and say there is hope, there is a way out. But in your mind at the moment, because everything's so in your head that you can't express it, you think that, but it's not really that.
Yeah. Or you're not allowed to express it.
Yeah.
Because of whatever your social situation is, or the structure of your home, you might express that to someone in your home, especially for us Pacific Islanders. This has been my experience. Mm-hmm. You say something and they're like, stop being dumb, or you're being silly. And you just have to move on. And now, if that was the last person that they were trying to get help from, and that was the response, then I have no hope.
Yeah, it is, and it's so true. And like you said, sometimes they feel like they can't. I had a woman come into me a teenage young adult come into me the other day, and she says, I'm really embarrassed to be here. She said, because I was told I'm Samoan and I don't get depressed, but I feel depressed, you know? And so helping to understand it doesn't matter what culture you come from, people get depressed. And it's not a negative thing, it's a positive thing she came in, because now we can go, what can we do? It's the same if you get sick, you go to a doctor and the doctor goes, now what can we do? And it's the same with taking care of our mental health.
Yeah. And unfortunately, when we talk about the generational things, sometimes even in our own church, we misinterpret what God's love is for us. So now we're dealing with people who have same gender attraction, or they may have lost a spouse to infidelity. And then they think, well, I'm worthless because this is what the church or God thinks of me. When really that's not the truth. The truth is you're loved regardless of those situations, that God loves you, and there's opportunities for you to get over whatever it is you're struggling with mentally, even as you try to deal with what it is you're dealing with spiritually.
Yeah, so true, so true. So what's one message of hope or advice you would share with someone who is looking for help and looking to take care of their mental health?
Oh, that's a tough one. But this is one thing that I have, having worked with so many youth and young adults in the church. One of the things that I have reminded them of is, first of all, God's love, but also that what you see on social media isn't always 100% true. And what I counsel them to do is take some time away from social media and go have some face-to-face interactions with people. We've kind of lost the art of communication because we're doing it via these technological advances rather than sitting face-to-face. I'm energized when I sit in front of a person who is just as energetic about meeting someone and having a conversation, a human interaction that takes me away from all of the vitriol that you see on social media. So that's, I think, my best advice to young people especially is walk away from your devices. The cool kids say it's touching grass. Just get out into nature, experience the things around you that don't have to do with your social circle on social media, which in many cases, we're always trying to put up our best self when inside we're not really communicating how we're feeling inside. So just get out, experience new things, talk to people, and just have human interactions that don't include your devices. I think that will help tremendously.
I do too. I see so many people who, I saw a boy the other day and I said to him, so how many do you have friends? And he said, yeah, I have 438. And I went, oh, 438? And I was at his home. I was doing that. Because he couldn't come to my office, so I was at his home. And he pointed to the screen, and he said 438. And I said, how many of those people have you seen face to face? And he said, none. And that made me really sad.
Yeah.
That he had, and I said, yes. Do you have any face-to-face friends? And he said, oh no, I talked to them on online, but he didn't have any friends, and so that's why he was struggling to come out of his home. Yeah, so it is. It really has taken away a lot of that interaction that we had when we were younger. When I was younger, when we were younger, no phones, no mobile phones, one phone in the house. Everyone could hear your conversations, and you met up with your friends.
Yeah, and we were also used to just meeting up with friends. Go to the mountains, go to the beach, go to the mall. Yesterday, Suzanne, we were having a conversation with our young men about the emotional effects of being bullied, whether it's online or in person. And we found out through one boy's feedback that the reason he's mean to girls is he doesn't know how to interact with girls. He comes from a family of all boys. And when he's struggling with things he doesn't feel confident in, it's better for him to hurt another person so that they can feel like he feels. So it was really sad to hear that. And so I recommended the same thing and say, hey, if you don't know how to talk to girls, what's the fix? Talk to more girls. And you'll find ways to be comfortable in those conversations.
And it's so true. And I find that a lot when I work with a lot of young people. I went into schools and I was doing some work with some kids in school, and that was a lot of it. They don't know how to interact. They don't know how to socialize. They don't know how to talk.
Yes.
They take themselves away and sit in a corner at lunchtime because they don't know how to communicate really well. They might say something dumb.
Yeah.
And so they'd rather not say anything at all. Yeah. We've lost that.
Yeah.
A lot of our people have lost that. Socialization and communication. Yeah.
Absolutely. Even in marriages.
Yes.
I've found that many of the problems that I have with Jen or between us, it's usually because we haven't communicated properly. So I've gotten better as a husband to say, okay, this is what I heard. Is this correct? And she'll say back, yes, that's correct. All right. Let's move forward.
We lack our communication. I think of even my kids. My son yesterday, he was downstairs and he's texting me, asking me something. And I'm like, son, why can't you just yell out and say, Mom?
Walk upstairs.
I know, right? But we get it. Yeah. Today's society, we've got to be really careful about how we use the device. Devices can be awesome and they can be horrible.
Yes.
And so it's working out which one are we doing. Yeah.
I agree.
Oh, thank you so much. I just really want to spend a few minutes just talking about mental health and your thoughts. So thank you so much for joining me and talking with me on this.
You're very welcome.